Cervical cancer is highly preventable with regular screening tests and appropriate follow-up care. That's according to the CDC. ABC 7's Alex Redmond joins us now with information on new screening recommendations. Alex.
Thanks, Haley. The new suggested guidelines mean less doctor visits and less tests for many women here in the U.S. Nancy Fern says there are benefits to being 65.
Yes, I'm great, and I'm finally on Medicaid.
Fern just learned new cervical cancer screening guidelines will mean fewer doctor visits.
I would have done it yearly until, I guess that went on forever. I know my mother at 80 was still getting pap smears every year.
30 years ago, actually before 2013, the guidelines were that we had women come in and begin gynecologic examinations and pap smears at age 18 or when they started sexual activity, whatever age that was. With the advent of us being able to identify the HPV virus and pick that up in testing, we now know that there's a number of strains that are considered high risk.
Dr. Devine explains that we know that the HPV virus causes the cancer. And we used to think that once you had HPV, you always had it. But we now know that younger women clear it sooner than we thought.
Now, recommendations are under age 21, no screening whatsoever, regardless of risk or exposure. 21 to 29, recommendations are pap smears every 3 years, checking just the cells. You don't have to check for HPV.
For women over the age of 30 where the rise in cervical cancer is seen, says board-certified gynecologist Dr. John Devine, pap smear and HPV testing combined every 5 years are suggested, or cytology every 3 years up to age 65.
After 65, if you've had 3 normal cytology or cell studies or 2 of the combined cell and HPV studies, you can stop screening.
I never had abnormal pap smears. But for those of us who've had pap smears every year for our whole adult lives, it's going to decrease that amount.
Fern is one of the women who will no longer need to be screened.
I'm definitely happy with this. And yet I feel like I'm still taken care of.
We will post those screening guidelines for you at mysuncoast.com. You can just click on health.
And Alex, what about some women out there who maybe feel differently and they're concerned about this less screening? They don't want to stop the screening.
Right, absolutely. Some women out there are a little bit concerned, and what you need to do is have a conversation with your own doctor that knows you and can ease your fears or allow you to go ahead and get the tests if you really need them, if he feels you need them and you do. But it's a collaboration between you and your physician.
Right. As always. Thank you, Alex.